Hi, I'm Shelia Malone, along with Dr. Clifton Addison, and we present The Argument for Culture as a Significant Determinant of Health, a systematic review of contemporary literature. We have no disclosures related to this presentation. This systematic review examines how cultural factors impact the outcomes of health promotion and health outcomes either intentionally or unintentionally. We explore how variation within and across cultures can be considered within a study. Healthcare practitioners have focused primarily on disease progression and treatment. In this review, we focused on the impact of culture on cardiovascular disease, the role of faith in health decision-making, and the impact of traditions and norms on health outcomes. We began with two questions. First, does a patient's culture matter in healthcare delivery? And second, what is the best way to implement the cultural factor in healthcare delivery? We use perspective to formulate our questions. It is the most comprehensive, current, and flexible question structure. It is suited for complex interventions. It accommodates quantitative, qualitative, and mixed methods questions. It incorporates features of other structures such as optional comparison. Perspective emphasizes subjectivity of qualitative questions. It is high profile and recognized or endorsed by the World Health Organization. For our systematic review, we focused on multiple databases. Filters matched the intended purpose of the review. Extensive supplementary strategies were used to improve sensitivity. Study selection and summaries. There were 18 overall studies used. 61% were qualitative, 22.2% were quasi and non-randomized studies, 16.7% were systematic reviews. 72% of all studies focused on African American communities. 11% focused on the role of faith and the church in health decisions. Explicit judgments about the risk of bias for important outcomes both within and across studies were made using a scale of low to high. This required identifying the most important domains that fed into the summary assessment. The risk of bias here is considered acceptable using the Rokvitz instrument. The results are overall low risk of bias and imply confidence that the study results are considered valid. The body of knowledge suggests that there is a trend of cultural complexities being considered in the design of healthcare delivery models aimed at changing health behaviors to improve health outcomes based on cultures. The best way to implement the culture factor in health delivery is through cultural humility. It embraces the differences and complexities in a population. Cultural humility requires that constant self-evaluation take place. By exploring and reflecting on their own beliefs and behaviors, healthcare practitioners can approach patients more openly and with a genuine curiosity about each new patient. Finally, the interface between healthcare delivery and cultural factors points to a fruitful collaboration between health practitioners, researchers, anthropologists, sociologists, and others in intercultural studies in the pursuit of best health practices and patient efficacy. I would like to acknowledge Dr. Clifton Addison, Associate Professor and Senior Research Scientist in the Jackson Heart Study Graduate Training and Education Center at Jackson State University School of Public Health, College of Health Sciences. And thank you for listening.